Hi guys, it's Dr. Gibson and welcome back. Thank you for joining me today. We will be talking about the ill effects of inflammation and ways we can combat this process. So let's talk firstly about acute inflammation. So acute inflammation happens when we, for example, get an ant bite or sprain our ankle or have a cold, and there are signs of the inflammatory process. So there's redness and swelling and pain and heat in the area. And this eventually resolves, of course, as our body defends itself and we heal. There are also other processes such as inflammation that occurs in autoimmune disease. So for example, multiple sclerosis, rheumatoid arthritis, systemic lupus. These diseases result in inflammation in multiple organs, joints, the skin, and these are usually, in most cases, easy to detect. There's another process called chronic inflammation, which we are recognizing more and more, even in association with diseases which we did not know were associated with an inflammatory state. So diseases such as obesity, as well as diabetes mellitus type 2, Alzheimer's disease. These diseases as well are associated with an inflammatory state. But chronic inflammation is often a really insidious process that lingers, and it's hard to detect because the symptoms are actually so vague. So symptoms could include brain fog, fatigue, vague muscle aches and joint pains, and really this could be just symptoms that could be in multiple other disease processes. So what is it that might cause this chronic inflammatory state? So it's anything that the body perceives as being a toxin or possibly continuously harmful to the normal homeostasis of the body. So a poor diet, for example, or environmental toxins such as cigarette smoking, also a sedentary lifestyle, lack of sleep, excessive stress. These can all contribute to chronic inflammation. So let's talk a little bit about obesity. Obesity affects about 40% of Americans, and it is not a problem of the Western world, it's a problem of the entire world. In obese individuals, there's increased pro-inflammatory cytokines such as tumor necrosis factor and interleukin. And as the adipose cells become bigger and more numerous in size, there's even greater release of pro-inflammatory markers. And this leads to the cascade that contributes to insulin resistance. So let's talk a little bit about diets. So we know that diets that are high in saturated fats, as well as processed foods and refined sugars, are associated with pro-inflammatory molecules in a pro-inflammatory state. A lot of people have questioned the importance of red meat in the whole inflammatory process, and really there's a paucity of data on red meat. Red meat actually got the bad rap in the low-fat craze. And we're not certain whether red meat in itself is associated with inflammation. And we have to consider the way red meat is eaten in the society. So for example, people tend to enjoy hamburgers, which have burger buns, which are highly processed, as well as a side of fries. And also, steak is generally eaten with potatoes. So there's a lot of carbohydrates involved with the red meat intake. So we cannot say that red meat in itself is actually bad for us. We just don't know. Of course, as we talked about in previous videos, it's important for us to get our meat from healthy animals. So grass-fed cows that are minimally processed, that are free range and organic are ideal. They have higher vitamins and definitely would pose less of a threat to our health than unhealthy animals. Let's talk a little bit about the lack of exercise. So people who sit for prolonged periods of time have been found to be at an increased risk for death. And they've also been found to have increased levels of interleukin-6. So this may actually be involved in a pro-inflammatory state. So let's talk a little bit about stress. I think we've all experienced stress, but in today's world, it seems as if stress can become just a persistent issue that is continuous throughout the day or affects our home life. So if we have a job in which we're stressed all day or an unhappy marriage, this could cause continuous stress in our lives. And basically, when there's a lot of stress, there's the release of cortisol. And cortisol in itself is an anti-inflammatory hormone. But when its release is sustained, it is akin to insulin resistance. So basically, the anti-inflammatory effects are actually decreased and the body becomes less responsive to the anti-inflammatory effects of cortisol, which leads to heightened inflammation. So why is this inflammatory state actually important to us? We have actually been measuring inflammatory markers for decades with the use of CRPs and ESRs, or so-called sedimentation rates. And these were important markers for a lot of disease processes, such as our autoimmune disease. But in COVID-19, CRPs became even more critical because it helped us to determine which patients needed certain drugs and what the risk of disease progression and death was due to the COVID process. Now, we have found that outside of autoimmune disease and COVID, that there's increased inflammatory markers just in the general population, and there have been associations with increased inflammatory markers and coronary artery disease, for example, as well as increased mortality. In fact, in an elderly population, it was found that people who had higher levels of interleukin and tumor necrosis factor were actually higher risk for a shorter life. So these inflammatory markers basically can't give us an idea of life expectancy, but it might point to the fact that there is an underlying disease process. Now, if the inflammatory markers are super high or normal, it might give us a better indication than inflammatory markers that are in between, because they don't really tell us that there's a specific disease process going on, and it doesn't really give us an indication of prognosis. Low-grade inflammation in midlife is actually an independent risk factor for cognitive decline later on in life. Interleukin-6 and tumor necrosis factor alpha actually have been shown to have a greater association with cognitive decline than CRP. We also can't forget the gut microbiota in this whole process. The gut microbiota, remember, is responsible for either promoting inflammation or decreasing inflammation depending on the chemicals secreted. So how can we stop chronic inflammation? First of all, let's talk a little bit more about diet. So we already discussed about processed foods and refined sugars and processed meats, that these contribute to inflammation. So that would be perhaps the easiest first step in order to reduce the inflammatory process. Now let's talk about the foods that actually help to decrease inflammation. And of course, we go back to a lot of natural foods, and we'll talk firstly about our vegetables, our green leafy vegetables, onions, garlic. They have a lot of anti-inflammatory substances. Tomatoes actually have the carotenoid lycopene, which is a strong anti-inflammatory substance, and it also decreases oxidative stress. So let's talk about other fruits and vegetables which have anti-inflammatory effects. So our cruciferous vegetables, such as our broccoli or cauliflower or Brussels sprouts, are actually anti-inflammatory, and as well a lot of our fruits have, such as our colored or brightly colored berries and plums and cherries have anthocyanins, which are also anti-inflammatory. And we cannot forget resveratrol, which is present in grapes and also wine, which has been shown to have anti-inflammatory effects as well. Omega-3s are a big part of this anti-inflammatory equation, and those are also present in nuts, such as chia seeds and hemp seeds. And don't forget the fatty fish. So our salmon or sardines and mackerel also have large quantities of omega-3s. And these omega-3s have actually been shown in certain circumstances to decrease the risk of Alzheimer's disease. Polyphenols such as the flavonoid quercetin in apples help to reduce inflammation, regulate the immune system, and stimulate healthy cell function. Barley is a complex carb containing polyphenols which help in the process of reducing inflammation, normalizing the immune system, and assisting with healthy cell function. Collard greens include vitamin A and magnesium, help to build a healthy immune system, and may help to reduce inflammation and fight fatigue. Curcumin that's present in turmeric enhanced by black pepper has also been shown to have some anti-inflammatory properties. Also, good oils such as olive oil, flaxseed oil, avocados, these all have anti-inflammatory properties. And let's not forget the things that may be delicious to us. So for example, teas, green teas, black teas, all have anti-inflammatory properties. In fact, matcha green tea has about 100 times the antioxidant effects as regular green tea. A little bit harder to digest, but certainly if it's something that you could incorporate in your diet, probably worth a try. And let's talk about wine, which has resveratrol. Definitely perhaps a small glass of wine daily might help to reduce inflammation. Dark chocolate, to all the dark chocolate lovers, 70% cacao, and also be careful with the amount of sugar and sweeteners that are added. And of course, if you have a little nut in there, such as almonds, that might help in terms of also having added effects for our health. Getting good sleep is an important part of maintaining our health. And sometimes that's really difficult with a busy life, especially for those of us who work and have also a busy family life. But getting between 7.5 to 8 hours of sleep seems to be ideal for most people. In fact, studies done at Emory University in Atlanta did show that there's increased inflammatory markers in people who got less than 7.5 to 8 hours of sleep. But also, interestingly, if you got more than 9 hours of sleep, there was also increased inflammatory markers. So as in everything, there is a fine balance. We need to find ways to exercise regularly. And remember, although it's recommended that you get approximately 30 minutes of moderate exercise a day, this can start little by little. So if you don't have a lot of time, try to work in 10 minutes in the morning or 10 minutes as soon as you get home from work. Take a brisk walk around the neighborhood, something to just get the habit going. Also, try to find ways to reduce your stress, and that's different for everyone. Exercise, of course, can reduce stress, but also consider meditation or yoga, both of which have been shown to decrease anxiety as well. So these are other options for us. If you like music, dance, if you enjoy doing some other sort of hobby, try to integrate it in your lifestyle. So I hope you were able to just get an idea of what chronic inflammation can do to your body and actually have simple steps that you can implement to decrease the inflammatory response and live a healthier life. Once again, I'm Dr. Gibson. Thank you for joining me. If you enjoyed what you heard today, please like my video and subscribe below. And I would love to have comments about different topics that I can discuss that you may be interested in. Once again, bye.